Well, one of the other major concerns for business leaders, of course, is healthcare. And today came some positive news on that front. According to the Centers for Medicare and Medicaid Services, healthcare spending in the U.S. grew at the lowest rate ever recorded last year. But with new regulations of the Affordable Care Act set to take effect in 2015, some companies could face legal headaches. Bertha Coombs has our story.
Honeywell never expected to be sued over its wellness plan. Under the Affordable Care Act, it can use incentives to reward employees who work on their health and charge more to those who opt out.
If they don't get the survey, then they have to pay $100 more a month for their policy. So we don't refuse anybody any coverage. And the whole point is, why should people who don't care about how they're living, why should they be being able to take advantage of all the people who do care?
Trouble is, under the Americans with Disabilities Act, requiring a medical screening, then punishing people for not getting one is discriminatory. That's why the Equal Employment Opportunity Commission has sued. Some analysts see more lawsuits ahead, with the so-called employer mandate going into effect in January, requiring large firms to provide insurance for workers who put in 30 hours a week. Under the ACA, workers could sue if their hours are cut and they lose coverage. Chris Williams of Travelers Insurance says employers haven't been focused on those risks in the law, but plaintiffs' lawyers have, and have already been looking to line up aggrieved workers.
There's thousands of pages of regulations, and they're going to look through those regulations and the statute to come up with novel causes of action. We've started to see that already.
It's not just private companies. Municipalities with large numbers of unionized workers, teachers, firefighters, and officers could also find themselves caught between conflicting parts of the health reform law.
Labor lawyers say it could intensify next year as employers try to cut back on benefits on those rich union plans in order to avoid one penalty of the ACA, the so-called Cadillac tax. That could well expose them to another side of the health reform law in the way of litigation. Bertha Coombs, Nightly Business Report, New York.